A burial in hazmat suits. One of thousands of victims of the coronavirus outbreak in Spain. Hospital staff in Madrid don't need to see the statistics to know Spain does not yet have a handle on the epidemic. It has been a deadly week for the country, second in daily fatalities only to Italy. A shortage of equipment and medical staff has left doctors and nurses overwhelmed. Amnesty International reports that over 9,000 Spanish health service workers have become infected with the virus, more than in any other country. Even healthy staff face isolation once they return home, careful not to spread the disease to their families. We're having a hard time. You feel very lonely and then you go home and you're alone again. You remember all the images you saw during the day and you keep thinking and thinking and you can't rest. You go home with the images in your head of everything you see here. It's very difficult to disconnect. It's impossible because you also feel helpless and sad. But their work is not in vain. Thousands have recovered because of their efforts. At this field hospital in Madrid, 34-year-old Graciela Alonso is going home. I have COVID-19 and I was in this hospital for the last 4 days. I have to say that in the beginning, I had a really bad time because I had that feeling of not being able to breathe. But thanks to all the support I received here, all the measures that they've taken, it wasn't so hard. For Alonso, the ordeal is over. But for Spain, the path to recovery is still uncertain.
Let's bring in journalist Jaime Velasquez. He's been following the situation from Madrid. Jaime, Spain has been one of the hardest hit countries by the pandemic. Experts estimate over 500,000 people are likely infected. Is Spain now reaching the peak of the crisis, you think?
Well, that's what the health authorities are hoping. They said that cases might be stabilizing at the moment, even though it's hard to believe now that we had more than 800 deaths in just 24 hours. But that's what they expect we will see in the next coming days if we see a slowdown in the number of cases reported to the emergencies.
You live in the capital, Madrid. That's where most of the cases are. And I imagine that's because it's the most densely populated city, or is there something else at play here?
Well, it's definitely one of the reasons, but also the health services might be strained to capacity because of the previous anti-austerity measures that were introduced in the past years, and also because of probably a lack of testing. A lot of people have been at their homes, also confined at their homes, but sharing with the family without knowing that maybe they were positive and they might be have infected other people in the family, inside the family, or even going to, I don't know, to buy supplies at the supermarket without knowing that they were COVID-19 positive.
There's been a curfew, obviously, for 2 weeks. How are people dealing with these restrictions?
Well, it's very difficult for the people to cope with this situation. Let's remind that it's been 15 days and it's going to be another 15 days. There's 15 days ahead. People have been applauding and cheering to the health workers at the balconies, but now it's getting more and more complicated to keep up with that high spirits, because it looks like we are probably losing the battle at this moment. That's the feeling in Madrid, that we are not doing enough to save the lives of the people that are infected.
Thank you so much. That's Jaime Velasquez in Madrid. Stay safe, Jaime.
Thank you.